So I'm doing a presentation on the SableFlex. Let's get it big. Okay, so this is SableFlex. This will give you a little bit of an idea of what it is, what it looks like. It's a spring-assisted orthosis. So these little metal beads can be adjusted for different varying degrees of extension. They're controlled by a spring up here by the wrist. And then the thumb similarly just by its own spring. So we'll get a little bit more into what it does here in a bit. So what does the SableFlex do? The purpose of the SableFlex is to allow patients that suffer from neurologic conditions inhibiting wrist and hand motion the opportunity to utilize repetitive task-specific training as a method of rehabilitation. So patients that would normally be unable to flex and extend their fingers are able to do so repetitively with the help of the SableFlex. This ability allows for functional practice. So the populations that this has been tested in and is best utilized for are people with traumatic brain injuries, incomplete spinal cord injuries, acute stroke, and any neurologic condition resulting in paresis of the wrist or hand. So anytime somebody has increased tone in their wrist or hand, they could benefit from the SableFlex. So here are a couple components of the SableFlex. They have digit caps that go around each of the fingers and connect to the springs, the finger lead mounts, extension springs that go down at the wrist, and those different colors allow for varying degrees of force of extension, and then the thumb system, which is similar to the fingers but specifically mounted off to the side for the thumb. So how does the SableFlex work? The patient's hand is naturally in flexion because they have hypertonicity and they're unable to effectively extend their hand. The SableFlex extends the hand when the patient is relaxed and they flex against its resistance to be able to grasp. And so this allows for constraint-induced movement therapy, which yields results. And so I have a video here that kind of shows this man using the SableFlex. So his baseline, he's trying to grab that ball. His left hand is stuck in a flexion tone pattern. And so effectively, therapy is not working. With the SableFlex, it extends his fingers, and he flexes against that spring's resistance to be able to grasp that ball and put it in the basket. So it keeps him naturally into extension, and he uses his hypertonicity to then flex. And then when he releases or relaxes, his fingers will go back into extension again. Just like that. So this shows 6 months later he's able to grasp a ball on his own without the use of the SableFlex due to the constraint-induced movement therapy, bouncing a racket ball, and even taking a drink out of a water bottle. So these are some pretty impressive results in my mind. The type of practice that this man or other similar patients wouldn't be able to utilize because they wouldn't be able to do the practice without the use of the SableFlex. So I like that video. All right. So the pros and cons of the SableFlex. Some of the benefits are that it allows, like we saw in the video, allows for constraint-induced movement therapy. The research shows that it has beneficial results even after just 6 months of use, as you saw. It's simple to use, and patients can use it in the clinic or at home. If they really want to, they can even purchase a device for their homes. Some of the drawbacks are it's slightly expensive. You can only have one user at a time per SableFlex, obviously. And then as a clinic, you would need a left and a right upper extremity SableFlex device because it only fits one hand. Some of the precautions I was able to get from a phone interview with the company. So patients have to be considered, they have to meet certain criteria to use a SableFlex, and that is they have to have 15 degrees of active shoulder flexion and elbow flexion, and they have to have 15 degrees of active wrist extension. Also, they need 85% of their finger passive finger extension so that the springs can do their job. The contraindications are that it's not for patients with joint contractures, inflammatory diseases like rheumatoid arthritis, because it would probably be painful for them. Any kind of joint deformities, that also draws back a little bit to RA. And then obviously any open wounds on the forearm or hand that would need to heal up before use of the SableFlex. Are there any similar products out there like the SableFlex? SableFlex is a brand name of a product. It's and so the company itself is called Sabo or Cilia Research, and so they make things like the SableFlex and the Sabo Reach. I'll show you some of those other devices in a bit, but all other orthoses similar to the SableFlex are they're not really meant for dynamic usage. So this one, I have a picture here. It is meant to hold the fingers open in a neutral position and the wrist in slight extension, but it's not meant to assist the patient in grasping and dynamic motions. And so the SableFlex is kind of set apart in that regard. And then there also is not much research. I didn't find any research specific to any other products that are similar to the SableFlex. What's your return on investment? So as a clinic, you have to decide, is this a product that is going to be worth us buying? Is this something that's going to yield results? And if so, how much are we paying for the product? The research shows that it's effective. However, a decent amount of the research seems to have been done by the SableFlex company, Cilia Research. And so, I mean, there's obviously bias there. Most of the studies have small numbers of participants and have a narrow focus, but they show good results. So I just wanted to show you here. This is their research page from their website, and it has tons of studies. Not all, but most of them, performed by their own research teams. However, something I did notice is that most of them have, 8 patients, really small numbers, 5 patients, 6 chronic patients. So, I mean, 8. There's something to consider there, that there's not a huge, sample size. But like I said, those studies have been shown to be effective. Okay, so back to here. The studies, other than Sabo, the company, show positive results as well. Most every study that is talking about a spring-assisted hand orthosis deals with the SableFlex brand, because like I said, there's the other spring-assisted hand orthoses. I'm not sure if there is one that functions dynamically like the SableFlex, so it's kind of set apart in that regard. And I haven't found from the research, I mean, obviously they wouldn't put it on their website, but even from external resources on the HPD library and stuff, I have not been able to find negative results from usage with the SableFlex. So it seems to be a device that would be beneficial in therapy. So the cost of the SableFlex ranges from $600 on the low end to $1,000, and they have payment plan options, $160 a month. But they sell a whole range of things. It's not just this SableFlex device. They can sell you, simple things like the baskets and the balls that they work with. Maybe there are certain weights or designs, I'm not sure. But they have a whole workstation that they can sell you that houses the SableFlex mechanism. Also, they have things like the Sabo Reach that you can see here on the right that goes on the elbow. They have things like the Sabo Glove, which differs slightly from the SableFlex in that it's for somebody that doesn't have hypertonicity. They have the Sabo Step for people with foot drop, and several other products. So, you can really invest in this company and become trained in Sabo trained and everything. But that's your prerogative as a therapist if you think that's going to be helpful for your patients and if that's going to be a good return on investment for you. Here are a couple of my references. Some of them, are just YouTube videos, and other are simple phone interviews, but I figured that they were pretty effective, that I was able to speak with the company, and that's about it for me. I hope you enjoyed, and if you have any questions, feel free to ask. This is just a little glance at their website that talks about purposeful movement and some other uses for the SableFlex if you're interested. Thank you very much.